COVID-19 has brought an undue level of physical, mental, and emotional stress, especially for our frontline workers. This episode explores ways leaders can effectively support their caregivers and protect the resiliency of their teams.
COVID-19 has profoundly affected the way many of us are practicing and working. We're communicating through masks, we're caring for patients who are separated from their loved ones, and we're witnessing more suffering, more death, and more dying, unfortunately. And this has been described as a perfect storm for creating psychosocial traumatic stress in our teams. From the obvious direct threat to our lives and the lives of our loved ones to the rapidly changing protocols that we're dealing with, it's been described to me that it feels like practicing medicine on the fly without a playbook. And this can lead to clinicians feeling like we're not giving the care that we're used to being able to give, and unfortunately leading to moral distress and moral injury. And finally, COVID fatigue is real. Our clinicians are tired. We've been at this a while without a break, and it's definitely taking its toll. At ChristianaCare, we were incredibly fortunate. We had a robust infrastructure in place, including a fully staffed Center for Work-Life Wellbeing to support our caregivers prior to COVID-19. And that investment has served us so well. It enabled us to pivot, rapidly scale up, and provide an unparalleled level of support to our caregivers during this crisis. The cornerstone of our approach in supporting our caregivers is rounding. So members of my team in the Center for Work-Life Wellbeing are conducting in-person rounding on frontline healthcare providers on all shifts, with a heavy emphasis on the COVID units, the emergency departments, and the areas supporting those units. The purpose of rounding is threefold. First, it's to supply basic well-being needs. So we have a cart that we bring with us with food and drinks and comfort items like ear protectors, lip balm, and hand lotion. It's really not about what's on the cart, though. The cart is an entry into a deeper conversation with the caregivers. So consistent with disaster mental health best practices, we're not waiting for people to raise their hand and say they need help. We're proactively reaching out to find out how people are really doing and provide in-the-moment support, and also serve as a conduit and a direct pathway for more intensive mental health or peer support services. And finally, rounding helps us elicit concerns and identify unmet needs. By rounding, we're asking our clinicians what they need, and we're able to identify concerns that require escalation to local or system leaders. And this has led to countless system-level changes, including prepayment of child care services, providing a scrub service and changing area, and the creation of a caregiver relief fund.
Healthcare leaders need to understand that caregivers want to be heard, they want to be seen, they want to have their concerns understood and addressed, and they want to know that they're in the loop, that they know what's going on. The more that leaders can keep their teams informed, support them where they need support, provide the kinds of resources, whether it's space for them to decompress after a really hard moment, or ways to help take care of their kids as we are all shut down, giving them those supports that allow them to focus on their patients and not have to be worried about the impact on their own families. In addition, in the longer term, we need to help people understand the value and the importance of self-care. We need to say, as leaders, it's okay to take some time.
If you're a leader, check in regularly with your teams and in person whenever possible. It's not okay to just support your frontline clinicians from behind a computer screen. You actually need to get in the trenches with them. And remember that you're also a role model for your team. Attend to your own health and well-being. Take time to breathe, to rest, to recharge, and get away for breaks while also leading your team.
You can't just build a wellness activity and hope people will come. You have to go to your front line, to your team members who are experiencing this trauma and say, what can we do for you? And then try to build that. Because if they're bought in from the beginning and you're addressing the need that they say they have, you're going to be much more likely to engage with it.
First, embrace the idea that we need to fix the coal mine, not just the canary. So you can't take the canary, teach it to be more resilient, and shove it back in the same coal mine and expect it to survive. You actually have to change the coal mine, the environment surrounding the clinician, by fostering a culture of well-being and removing inefficient administrative burdens, for example.
Clinical teams face so many challenges, and burnout, and particularly administrative burden causing burnout, is not something that's new. We've known for years that the impact of having to spend up to 6 hours a day in the electronic medical record, spending what some physicians refer to as pajama time with their electronic medical record to get things finished, all of that documentation burden, which can be everything from recording information in the electronic record to answering emails, to even the time that they spend logging back into secure systems, can take a toll on clinicians who are there to take care of patients, especially in today's environment where physicians and nurses and other clinicians are doing everything they can to take care of the patients that are in front of them. The less amount of time they need to spend on a computer documenting, putting details into a record, the more they are able to focus on those patients and then on making sure that they are taking care of their own well-being.
That brings me to the final important point for executive leadership. Implementing an effective well-being program requires financing a robust well-being infrastructure with staffing, budget, and political backing. It also requires making clinician well-being a key quality metric for your organization, something you measure, track, and hold yourselves accountable for, just like quality metrics, patient experience scores, and financial margins.
Leaders need to understand that whenever they enter a room, it's never a neutral event. It's either a positive event or a negative event, depending on how they interact with their teams. Understanding which one it is and how they can show up in that positive light with their teams is going to go a long way to protecting the wellness and well-being of those teams. An example of what leaders can do, which one health system CEO started with his team, was to send out 4 questions every week and ask all of his team to reply. What were they doing that week that they were most proud of? Where did they hit their biggest challenge that week? How often were they working in their strengths? And then the last and probably most important question was, how can I, as CEO, help you do your job better and easier? And that really allowed them to open a dialogue around what needed to be done and how it needed to be done, rather than talk about specific tasks. An example of involving the board in the work of the hospital was one hospital brought their board members in to shadow their physicians throughout a full day, understanding, whether that was a 6 a.m. surgery onto a full day of clinic visits, onto an evening of completing electronic medical record documentation, to understanding how their outpatient clinics ran. These board members were able to see exactly what it takes to take care of patients in their hospitals. And it gave them a rich understanding of the work and the sacrifices and the needs.
For many clinicians, the availability of the vaccine feels like the first real sign that there's a light at the end of this very long tunnel. We still have some difficult months ahead of us, but there's hope that we can get through this together. There's a quote that comes to mind by Judith Herman, and she states, "The solidarity of a group provides the strongest protection against terror and despair, and the strongest antidote to traumatic experience." And we're seeing evidence of our caregivers tapping into that collective strength to get through this together.
I feel hopeful because there is so much discussion and understanding in the field, even in the last 5 years, that has really shifted the conversation to an understanding that we need to be well ourselves before we can care for others, that we need to understand and value wellness in our work and in our home and in everything we do as a society. The other thing that gives me a huge amount of hope is seeing the work that AHA members are doing every day. I have the privilege of having conversations with physicians and nurses and other leaders across the country. And their dedication to their patients, to their teams, to everyone they are working with and everyone they are caring for brings tears to your eyes. It's amazing. And people like Dr. Farley, who are able to create ways to really support their teams and be able to provide care to their entire community in a way that really not only takes care of their community, but takes care of their caregivers and makes them feel fulfilled, is just a joy to watch.